Lorazepam. Expanded lecture note. Lorazepam is a medicine used to calm the brain and nerves. It helps reduce anxiety, relieve stress, and treat seizures. It can also help people sleep when anxiety makes it hard to sleep. Lorazepam works quickly to make people feel calm and relaxed. It is a useful drug in hospitals and clinics, especially in emergencies like severe seizures. However, it should be used carefully and usually only for a short time because it can cause side effects and dependence. Today, I will explain what Lorazepam is, how it works, what it is used for, and important things to know when using it. Objectives. By the end of this presentation, participants should be able to 1. Define Lorazepam and its classification. 2. Explain its mechanism of action, pharmacokinetics, and pharmacodynamics. 3. Discuss its clinical uses, especially in anesthesia, ICU, and emergencies. 4. Identify side effects, contraindications, precautions, and interactions. 5. Understand safe administration, nursing management, and patient education. 6. Compare Lorazepam with other benzodiazepines. 7. Highlight current trends and research on Lorazepam use. Other names of Lorazepam. 1. Generic. Lorazepam, the general name of the medicine. 2. Trade names. Ativan, Temesta, Tavor, Lorans, these are brand names for Lorazepam. 3. Drug class. Benzodiazepine, intermediate acting. Lorazepam is a type of benzodiazepine that works for a medium amount of time. 4. WHO essential medicine. Lorazepam is on the WHO list of essential medicines. Introduction to Lorazepam. 1. Lorazepam is one of the most widely prescribed benzodiazepines. 2. Used in anxiety disorders, sedation, status epilepticus, and anesthesia. 3. Research shows it is highly effective for short-term management of severe anxiety, insomnia, agitation, and alcohol withdrawal. 4. Preferred in elderly compared to diazepam due to lack of active metabolites. 5. Evidence supports use as pre-anesthetic medication and in mechanical ventilation sedation. The myths about Lorazepam. 1. Myth. Lorazepam is safer than all benzodiazepines. Reality. It still has risks of dependence and respiratory depression. 2. Myth. Lorazepam is a sleeping pill. Reality. It is primarily an anxiolytic but has sedative hypnotic properties. 3. Myth. Lorazepam has no withdrawal. Reality. Abrupt cessation leads to severe withdrawal. Classical definition of Lorazepam. 1. Lorazepam is a benzodiazepine sedative hypnotic that works by enhancing the inhibitory effects of GABA in the CNS, producing sedation, anxiolysis, amnesia, and anticonvulsant activity. Lorazepam boosts the effects of GABA, a calming chemical in the brain, causing sedation, anxiety relief, memory loss, and seizure control. 2. Lorazepam is an intermediate-acting benzodiazepine with anxiolytic, sedative, hypnotic, anticonvulsant, and muscle relaxant properties. Lorazepam has effects that include lowering anxiety, causing sedation, helping sleep, stopping seizures, and relaxing muscles. 3. Introduced in the 1970s as part of the benzodiazepine family, Lorazepam was brought out in the 1970s as a benzodiazepine medication. History of Lorazepam. 1. Synthesized in 1960s. Introduced by Wyeth Pharmaceuticals, 1977, Lorazepam was made in the 1960s and came out as a medicine in 1977. 2. Developed as a safer alternative to barbiturates, Lorazepam was made to be safer than older sedatives called barbiturates. 3. Rapidly gained worldwide acceptance for sedation and anxiety control. Lorazepam was quickly accepted around the world for helping with sedation and anxiety. Classification of Lorazepam. 1. Pharmacological class. Benzodiazepine. Lorazepam is a type of drug called a benzodiazepine. 2. Therapeutic class. Sedative, hypnotic, anxiolytic, anticonvulsant. Lorazepam is used for sedation, anxiety relief, and to stop seizures. 3. Controlled substance status. Schedule 4. In many countries, lorazepam is a controlled drug in many places, classified as Schedule 4, meaning it has some risk of dependence but also accepted medical uses. Chemical properties of lorazepam. 1. Chemical name. 7-chloro-5-2-chlorophenyl-1, 3-dihydro-3-hydroxy-2H-1, 4-benzodiazepine-2,1. This is the formal chemical name for lorazepam. 2. Molecular formula. CHClNO. This shows the atoms making up lorazepam. 3. Molecular weight. 321.16 grams per mole. This is the weight of one molecule of lorazepam. 4. Structure. Benzodiazepine ring with a hydroxyl at position 3 increases water solubility after conjugation. Lorazepam has a benzodiazepine structure with a hydroxyl part that helps it dissolve in water after changing in the body. 5. pKa. Approximately 1.3 pKa is a measure of how acidic or basic lorazepam is. Lorazepam has a pKa of about 1.3. Physical properties of lorazepam. 1. Appearance. White crystalline powder, oral form, or clear solution, injectable form. Lorazepam looks like a white powder for pills or a clear liquid for injection. 2. Solubility. Poorly water soluble, injectable form formulated in propylene glycol. Lorazepam doesn't dissolve well in water. The injectable form uses propylene glycol to mix it. 3. Stability. Stable at room temperature. Sensitive to light, protect vials from light. Lorazepam is okay at normal room temps but should be kept away from light. 4. Formulation. Oral tablets, oral solution, injectable solution. Lorazepam comes in pills, a liquid for drinking, or a liquid for injection. Mechanism of action of lorazepam. 1. Binds to benzodiazepine site on GABA receptor complex in the CNS. Lorazepam attaches to a spot on the GABA receptor in the brain. 2. Increases the frequency of chloride channel opening when GABA binds. When GABA attaches, lorazepam helps open channels letting chloride in more often. 3. Causes hyperpolarization of neuronal membranes. Right pointing arrow. Reduced excitability. This makes brain cells less likely to fire. 4. Produces sedation, anxiolysis, amnesia, anticonvulsant, and muscle relaxation effects. Lorazepam causes sedation, anxiety relief, memory loss, stops seizures, and relaxes muscles. Pharmacokinetics of lorazepam. 1. Onset IV 5 to 20 minutes, slower than midazolam. Lorazepam starts working in 5 to 20 minutes when given IV, slower than midazolam. 2. Onset oral 20 to 60 minutes. Lorazepam starts working in 20 to 60 minutes when taken by mouth. 3. Duration 6 to 8 hours. Sedation, anticonvulsant effects longer. Lorazepam's sedative effects last 6 to 8 hours. Effects on seizures last longer. 4. Protein binding. Approximately 90% lorazepam in the blood is attached to proteins. 5. Metabolism. Hepatic glucuronidation, not dependent on CYP450 enzymes, leading to inactive metabolites. Lorazepam is broken down in the liver to inactive parts. 6. Elimination. Renal excretion of glucuronide conjugates. Lorazepam's broken down parts leave the body in urine. 7. Half-life, 10 to 20 hours, prolonged in elderly and hepatic renal impairment. It takes 10 to 20 hours for half of lorazepam to leave the body. This takes longer in elderly with liver, kidney problems. Pharmacodynamics of lorazepam. 1. Produces moderate sedation with slower onset compared to midazolam. Lorazepam sedates patients but takes a bit longer to start than midazolam. 2. Long anticonvulsant effect, useful in seizures and status epilepticus. Lorazepam has long-lasting effect stopping seizures, helpful in severe seizures. 3. May cause prolonged sedation in ICU with continuous infusion due to accumulation. If lorazepam is given continuously in ICU, it might cause sedation to last a long time because it builds up. Storage and disposal of lorazepam. 1. Store at 15 to 30 degrees Celsius, away from light. Keep lorazepam at normal room temps and away from light. 2. Injectable solutions in amber vials. Injectable lorazepam comes in dark vials to protect from light. 3. Controlled substance. Dispose via hospital pharmacy protocols. Since lorazepam is controlled, get rid of it following hospital rules. Drug interactions of lorazepam. 1. Potentiated by alcohol, opioids, antihistamines, other sedatives. Lorazepam's effects get stronger with these drugs. 2. CYP inhibitors, e.g., valproate, may enhance effect. Some drugs like valproate might make lorazepam's effects stronger. 3. Additive respiratory depression with anesthetics. Using lorazepam with anesthetics might slow breathing more. Clinical uses of lorazepam. 1. Management of anxiety disorders. Lorazepam helps treat anxiety problems. 2. Premedication for anesthesia and procedures. Lorazepam is given before anesthesia or procedures. 3. Sedation for mechanically ventilated patients in ICU. Lorazepam sedates patients on breathing machines in ICU. 4. Control of status epilepticus. Lorazepam stops severe, long-lasting seizures. 5. Alcohol withdrawal syndrome. Lorazepam helps with symptoms of stopping alcohol. 6. Adjunct in chemotherapy-induced nausea and vomiting. Lorazepam can help with nausea and vomiting from chemotherapy. Use of lorazepam in ICU. 1. Continuous infusion for long-term sedation in ventilated patients. Though risk of accumulation, lorazepam can be given continuously for sedation in ICU patients on ventilators, but it might build up. 2. Preferred in patients with seizure disorders or requiring prolonged anticonvulsant coverage. Lorazepam is chosen for patients with seizures or needing long-lasting seizure control. 3. Often used when propofol or dexmedetomidine is not available or contraindicated. Lorazepam is used if other sedatives like propofol or dexmedetomidine can't be used. Use of lorazepam in anesthesia. 1. Premedication to reduce anxiety and produce amnesia before surgery. Lorazepam is given before surgery to lower anxiety and cause memory loss. 2. Less commonly used for induction due to slower onset. Lorazepam isn't used often to start anesthesia because it takes a bit longer to work. 3. Maintenance of sedation during regional anesthesia procedures. Lorazepam can be used to keep patients sedated during certain types of anesthesia. Use of lorazepam in emergencies. 1. First-line benzodiazepine for status epilepticus, IV bolus. Lorazepam is often the first choice for stopping severe seizures with IV injection. 2. Used in severe agitation or acute anxiety crisis. Lorazepam in cases of extreme agitation or bad anxiety attacks. 3. Sedation in patients with alcohol withdrawal seizures. Lorazepam sedates patients having seizures from stopping alcohol. Nursing management of lorazepam. 1. Monitor respiratory rate, BP, sedation depth. Nurses check breathing, blood pressure, and how sedated the patient is. 2. Watch for paradoxical reactions, agitation, aggression. Sometimes lorazepam causes expected agitation or aggression instead of sedation. 3. Prevent falls and injury. Due to sedation, nurses help prevent patients from falling or getting hurt because they're sedated. 4. Educate patients on dependence risk. Nurses tell patients about the risk of getting dependent on lorazepam. Administration and dosage of lorazepam. 1. ICU sedation. 1. Loading. 0.02–0.04 mg per kilogram IV. Lorazepam is started with a dose in ICU sedation. 2. Maintenance. 0.01–0.1 mg per kilogram per hour continuous infusion. Lorazepam is given continuously in ICU, adjusted for sedation. 3. Titrate to sedation goal, e.g., RASS-2 to 0, the dose is adjusted to get the right level of sedation. 2. Status epilepticus. IV bolus. 4 mg given slowly over 2 minutes. Lorazepam is given IV for severe seizures. 2. May repeat in 10 to 15 minutes if seizure persists, max 8 mg in 12 hours, the dose can be repeated seizures if needed. 3. Procedural sedation. 1. IV, 0.02–0.04 mg per kilogram 15 to 20 minutes before procedure. Lorazepam is given before procedures for sedation. Side effects of lorazepam. 1. Sedation and drowsiness. Lorazepam causes sleepiness and drowsiness. 2. Respiratory depression, dose-dependent. Lorazepam can slow breathing depending on dose. 3. Hypotension, especially with rapid IV push. Lorazepam can lower blood pressure if given IV too fast. 4. Confusion, ataxia, dizziness. Lorazepam can cause confusion, unsteadiness, and dizziness. 5. Pain or burning at injection site. Propylene glycol. Some people feel pain or burning where lorazepam is injected due to propylene glycol. Serious side effects of lorazepam. 1. Respiratory arrest. Lorazepam can stop breathing in severe cases. 2. Hypotension leading to shock. Lorazepam can cause very low blood pressure leading to shock. 3. Propylene glycol toxicity with prolonged high-dose infusion. Causes metabolic acidosis, renal failure, cardiac arrhythmias. If lorazepam is given in high doses for a long time, it can cause serious problems due to propylene glycol. 4. Tolerance, dependence, withdrawal seizures on abrupt discontinuation. Lorazepam can lead to tolerance, dependence, and seizures if stopped suddenly. Contraindications of lorazepam. 1. Hypersensitivity to benzodiazepines. Lorazepam shouldn't be used if someone's allergic to benzodiazepines. 2. Severe respiratory insufficiency. Unless mechanically ventilated, lorazepam isn't used in bad breathing problems and patient is on a ventilator. 3. Acute narrow-angle glaucoma. Lorazepam isn't used in this type of eye problem. 4. Severe hepatic insufficiency. Caution. May prolong sedation. Lorazepam is used carefully in severe liver problems because it might cause longer sedation. Precautions for lorazepam. 1. Elderly and debilitated patients. Reduced dose. Lorazepam dose is lowered for elderly or weak patients. 2. Caution in renal impairment. Risk of metabolite accumulation. Lorazepam is used carefully with kidney problems because broken down parts might build. 3. Prolonged sedation may occur after long infusions. Sedation can last a long time after stopping long-term lorazepam infusions. 4. Avoid abrupt discontinuation after prolonged use. Lorazepam shouldn't be stopped suddenly after long-term use. Advantages of lorazepam. 1. Long anticonvulsant effect. Ideal for seizure management. Lorazepam works a long time to stop seizures. 2. Not dependent on CYP450 metabolism, less drug-drug interactions. Lorazepam is broken down in a way that causes fewer interactions with other drugs. 3. Good for prolonged sedation in certain ICU scenarios. Lorazepam is useful for long-term sedation in some ICU cases. 4. Potent anxiolytic and amnestic effects. Lorazepam is strong for reducing anxiety and causing memory. Disadvantages of lorazepam. 1. Slow onset compared to midazolam or propofol. Lorazepam takes longer to start working than some other sedatives. 2. Risk of accumulation with continuous infusion leading to delayed awakening. Lorazepam can build up with continuous use, causing delayed waking. 3. Propylene glycol formulation can cause metabolic toxicity. The way lorazepam is made can cause metabolic problems. 4. No analgesic properties. Lorazepam doesn't help with pain. Clinical considerations for lorazepam. 1. Monitor for respiratory depression and hypotension. Check for slowed breathing and low blood pressure. 2. For prolonged infusion, more than 48 hours, monitor for propylene glycol toxicity, osmolar gap, metabolic acidosis. Lorazepam is given for over 2 days. Check for propylene glycol problems. 3. Reduce dose in elderly or organ dysfunction. Lower lorazepam dose for elderly or those with organ problems. 4. Flumazenil is the reversal agent in case of overdose. Use cautiously in seizure-prone patients. Flumazenil reverses lorazepam in overdose. Use carefully in patients with seizures. Comparison of lorazepam with other agents. 1. Lorazepam. Onset IV 5 to 20 minute. Duration 6 to 8 hours. Used for ICU sedation. Analgesia none. Seizure control excellent for long-term. Accumulate risk high. 2. Midazolam. Onset IV 1 to 5 minute. Duration 1 to 2 hours. Analgesia none. Seizure control good. Accumulation risk moderate. 3. Propofol. Onset IV 30 seconds. Duration 5 to 10 minute. Analgesia none. Seizure control yes for short term. Accumulation risk low. 4. Dexmedetomidine. Onset IV 5 to 10 minute. Duration 1 to 2 hours after analgesia mild. Seizure control 4. Accumulation risk low. Additional information on lorazepam. 1. WHO Essential Medicine for Seizures. Lorazepam is on the WHO list for treating seizures. 2. Risk of misuse. Right pointing arrow. Strict prescription control. Lorazepam can be misused, so prescriptions are tightly controlled. Current trends in lorazepam use. 1. Increasing use in ICU sedation protocols. Lorazepam is used more in ICU sedation plans. 2. Being replaced by dexmedetomidine and propofol in some centers due to delirium risk. In some places, lorazepam is being replaced by other sedatives because of delirium risk. 3. Ongoing debates on benzodiazepine use in elderly due to fall risk. There's discussion about using benzodiazepines like lorazepam in elderly because of fall risk. Research on lorazepam. 1. Studies show lorazepam effective in status epilepticus, but midazolam is emerging as alternative. Lorazepam works for severe seizures, but midazolam is becoming another option. 2. Research on minimizing withdrawal and dependence is ongoing. Scientists are studying ways to reduce lorazepam withdrawal and dependence. 3. Comparative studies with non-benzodiazepine sedatives in ICU. Researchers are comparing lorazepam to other sedatives in ICU settings. Patient education for lorazepam. 1. Take only as prescribed. Use lorazepam exactly how your doctor says. 2. Avoid alcohol and driving. Don't drink alcohol or drive while on lorazepam. 3. Do not stop suddenly, leading to tapering required. Lorazepam needs to be slowly stopped, not suddenly. 4. Report breathing problems, severe drowsiness, or mood changes. Tell your doctor if you have breathing issues, bad sleepiness, or mood shifts. Conclusion on lorazepam. 1. Lorazepam is a powerful benzodiazepine sedative ideal for long-term ICU sedation and seizure control, but its slow onset and risk of accumulation limit its use for rapid sedation. Lorazepam is good for long ICU sedation and seizures but isn't bad for fast sedation because it takes time to work and can build up in the body. 2. When used carefully, it provides stable, reliable sedation and prolonged anticonvulsant coverage. Used carefully, it gives steady sedation and long-lasting seizure control. Take-home tips on lorazepam. 1. Lorazepam equals intermediate-acting benzodiazepine. Lorazepam works for a medium amount of time. 2. No active metabolites leading to safer in elderly, liver dysfunction. Lorazepam doesn't have active broken-down parts. It's safer with elderly or liver problems. 3. Uses: anxiety, sedation, seizures, ICU, anesthesia. Lorazepam is used for anxiety, sedation, seizures, in ICU, and for anesthesia. 4. Watch for dependence, withdrawal, respiratory depression. Be careful of lorazepam causing dependency, withdrawal, or slowed breathing. 5. Always taper after prolonged use. Lorazepam should be slowly stopped after long-term use. Professional quote on lorazepam. Lorazepam is the marathon sedative, steady, lasting, and dependable, but not built for the sprint. Critical care sedation principle. Thank you for watching. If you like this content, don't forget to like to show your support. Comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.